Hi, welcome to my YouTube channel. I have as a special guest today Dr. Christopher Estes, and we're going to be talking about cancer screening, which is a really important conversation, I think, especially with the rising rates of cancer. So, first, I want to start off with my standard disclaimers. The information discussed today does not constitute medical advice, diagnosis, or treatment, is not a substitute for professional medical care, and does not create a physician-patient relationship. Similarly, the information discussed today does not constitute legal advice, is not intended to be a substitute for advice from a qualified attorney, and does not create an attorney-client relationship. On the contrary, the views and opinions expressed today are solely those of Susan Lee and do not reflect the views, positions, or policies of biogeometry or the National Call for Safe Technology. So with that, I'm going to introduce our guest, Dr. Christopher Estes, who is a dedicated and compassionate physician whose career has evolved from extensive experience with medically complicated patients. He became frustrated seeing people get passed from one specialist to the next without ever addressing the source cause of their medical problems. He now works to discover those causes for a broad array of medical conditions, no matter how complex. His practice at Miami Beach Comprehensive Wellness Center includes an integrated array of therapies for women and men, including functional medicine evaluations, intravenous and ozone therapies, platelet-rich plasma therapies, and peptide therapies. His specialties include management of mold, Lyme, and other environmentally acquired illnesses, gastrointestinal issues and dysbiosis, autoimmune diseases, natural approaches to fertility, hormonal management, and comprehensive detoxification program. Chris is also an expert in optimizing the health of high-performing individuals. Utilizing advanced analysis of telomere length, DNA methylation, and other biomarkers, he designs custom anti-aging and performance optimization regimes for people of all ages. Chris is an active member of the following societies: International Society of Environmentally Acquired Illness, Institute for Functional Medicine as a certified provider, International Lyme and Associated Disease Society, American Academy of Ozonotherapy, American College for the Advancement of Medicine, American Academy of Anti-Aging Medicine, A4M, American College of Obstetricians and Gynecologists, board certified and fellow. Chris provides approachable and comprehensive education to his patients and seeks to empower them to be the decision makers in their healthcare. He transcends the role of the conventional medical doctor by incorporating energetic and mind-body-spirit healing approaches. He is a lifelong learner, constantly honing his existing skills while adding new techniques and practices with each passing year. Thank you so much. Welcome.
Thank you for having me.
I'm curious because, in the news, there's quite a number of cancer tests. I'm hearing about Prenuvo, Gallery, and RGCC, these tests. So I was wondering, can we start first by sharing your thoughts or what you think about these tests? Like, what is the difference between routine screening for cancers and these newer, more advanced options like cell-free DNA and whole body MRIs?
Sure, I'd be happy to. This is something I discuss with patients all the time. So these newer technologies are not a replacement for routine screening. So we're talking about things like Pap smears for cervical cancer, mammograms for breast cancer, the various modalities we have for screening for colon cancer these days, chest x-rays and CT scans for lung cancer. We could go on and on. You can go to the American Cancer Society for guidelines, or United States Preventive Task Force Services, their USPSTF guidelines, and see these are what's recommended as the standard screening. And I still encourage everybody to do those things. Like those are not out the window. Okay. These additional tests are exactly that. It's like, well, if I do all those other things and they're negative, but I still have some sort of concern or I want to go to the next level, there are additional modalities we can use to help look for disease in very, very early states that might not be detected by these other routine screening tests at all. We can start with things like Prenuvo, which is a full body MRI. So a full body MRI essentially is, getting an MRI scanner. It's magnets. There's no radiation, and they scan you from head to toe. And part of what they're looking for, of course, is a tumor. And if they see a tumor somewhere, that may be an indication that you would benefit from further workup from whatever they might have seen. One of the upsides of doing these things is you also see things that are not tumors, right? So they're going to look at your joints. They're going to look at, other structures inside. They might find things like aneurysms, which are blood vessel malformations. So it's not limited to just cancer. There can be things that are detectable that have nothing to do with cancer, that can get picked up on a whole body MRI. Now, when I counsel people about going to do these things, Prenuvo is kind of the most popular. They're doing a whole lot of advertising, and I'm sure anybody now who watches this YouTube video is going to have it pop up in their feed because we said it. But there are other radiology providers out there who are offering these tests that may actually offer additional scans on top of this to consider, like concomitantly doing something like what's called a Clearly scan. That's Cleerly. That's a type of CT scan, not an MRI, but it looks for coronary artery disease using with IV contrast. That's a really good way to screen for cardiovascular risk. Again, nothing to do with cancer, but it might actually be a greater concern for an individual patient. And I might steer them in that direction to say, hey, if you're going to do some sort of advanced imaging for you, this might make more sense than that. Some of the other MRI providers may also be able to administer IV MRI contrast, which it is gadolinium. So it does come with a little bit of risk and toxicity. But in some individuals, it might actually be worth the risk, because without the MRI contrast, you may not be able to see everything that we would want to see. For instance, certain types of tumors, particularly things around the pancreas, things in the lungs, certain things in the central nervous system, may not show up very well without the contrast. So plain MRI has certain limitations. And I always ask people, like, whenever you're going to go for one of these things, find out what kind of machine they're actually using at the center, because there's different types of MRI machines, mostly based on the strength of the magnet. That's how many Tesla it is. Like there's 1.5 Teslas, there's 3 Teslas. The higher the Teslas, the more powerful the magnet and the higher resolution image you're going to get. So I always joke that the radiology is a technology game, and it's just like every year, how like your computer gets a little faster, and your TV. Remember the TVs we had back when we were kids? This big, huge box, and it was like a crappy picture. And I can even remember adjusting antennas. I'm that old. Whereas now you get like this skinny little thin thing that hangs on the wall, and it looks like, this beautiful 3D image. Technology and radiology is no different. Like every year they get new stuff and new software. So there's new software things that they're using to enhance the images, and AI assisted stuff, which can be very, very useful. So knowing that your radiologist is using the best tech is important, and knowing that you've got specialist radiologists who are doing the reading. So a lot of places they'll have 3 different radiologists read it. So they've got one person reading all the central nervous system, they got another one doing thorax and abdomen, and then they got another one who does all the musculoskeletal. So they get 3 different sets of eyes on this thing, whereas other places it's just one radiologist reading the whole thing. So, in other words, what I'm saying is the reads can be of variable quality. Based
Okay.
on the tech, based on who's reading, based on how it's done, with or without contrast. So those are things I talk about with people, and we base that on the individual person's risk profile. Like how high of a yield of a test is this going to be for someone who has very, very low levels of risk for disease versus someone who, say, has a really strong family history of things and or personal history that seems to increase their risk for cancers, or personal history of cancer themselves. Is there other things that we should be looking at?
Right. So then based on, your intake and what you gather from, your patients, you can determine and maybe help give recommendations on the types of tests for them. What about this gallery? What are your thoughts about, who would be a good candidate for getting this? I guess it's a one-stop blood test, right? That screens potentially 50 different types of cancer. There was a news article last month about it with a study. Maybe you can talk about that
Yeah,
and
before we
tell
got
me.
on, we were talking a little bit about that, and the study was not 100% positive in their favor because they didn't meet their primary endpoint. And the endpoint was trying to reduce the number of stage 3 and 4 cancers that were discovered in people who received the Gallery test as a routine. It was done by the NHS in the UK, apparently a very large study. I have not been able to find the actual actual study. All I've found is like summaries of it. So I haven't had time to go through all the data. I do have a degree in epidemiology too. I have an MPH. And I used to, review submissions for journals, and I'm a published author. So like, I would really love to see the actual data, but it doesn't necessarily mean that the test is absolutely worthless, but it may not hold as much promise as what they were hoping. Now it looks for the DNA of cancer circulating in your blood. It's called cell-free DNA. My short take on it is it seems to be pretty good at detecting some rare tumors, but for very, very common tumors, it seems to be a little bit less sensitive, particularly things like prostate, breast, and colon. So like if you look at the numbers on its sensitivity for those, it's actually not really high sensitivity. So it's an easy test to do. It's like a single tube of blood. It's not terribly expensive. And the false positive rate is relatively low. So like if it comes back with a positive rate, okay, so like it may mean something. A more sensitive test to do that is called the RGCC test. And I think we talked about that one briefly too. Now, RGCC is a different lab entirely that looks for actual circulating tumor cells rather than just the DNA. It seems to be a bit more sensitive and picking things up, and it gives a genetic characterization of the circulating tumor cells that'll help give us an idea of where it might be coming from. So it'll say, well, is this an epithelial tumor? Is this a mucosal tumor? It does have limitations, though. It won't detect skin cancers because those tumor cells don't really circulate. It doesn't detect central nervous system tumors well because those tumor cells don't circulate. So even that one has limitations. One of the nice things about RGCC, though, is if you find circulating tumor cells, they will test those tumor cells against various types of therapies to see what actually treats it. So it'll give you therapeutic options as well. And that's not just like chemotherapy agents, but they'll test natural substances. So does it work like, does high dose vitamin C help? Does, quercetin help? Does, artemisinin, artemisia extract help? It gives a little bit more information about the tumor cells than Gallery, because Gallery is basically just a kind of a positive or negative. It doesn't really give you a whole lot about treatment. And I make sure I talk to patients in detail about all of these ups and downs so that they understand, what they're getting into when they start.
Right. So here is Chris's contact details to book a consultation where he can go further into the different types of tests and see what would be appropriate for you given your profile, because you take a lot of information into consideration, giving your training, your education in medicine and healing. And I'm sure it is quite an educational consultation.
It's a lot of talking. Let's put it that way.
Yeah.
It's a
It's
lot
just
of
so
talking.
interesting because, there's this advancement of science and technology, and, you have these, diseases like cancer. And it's sort of like, what are your different options for screening so that, when it's detected earlier or treatment, it just opens a wider array of options, but also being educated, informed, and, as the new technology advances to know, how to make the best decisions with yourself. So, of course, you have to go with a trusted professional.
Yes, absolutely. You summed it up perfectly. Yeah, these are great tests for some people, but they're the sort of things where you need to decide what's right for that individual person and what makes sense for them. Especially since, like you said, these are not covered by insurance. This is all out of pocket, and you need to understand what the potential, what all the upsides are, but what are the potential downsides and what are the limitations, so that you go into this eyes wide open. That we're not quite at the magical Star Trek scan, right, where it's like they just kind of go over you and then like, oh, we know everything that might possibly be wrong with you. There's no test that exists like that. So even though it kind of seems that way when you first read about them, they're like, oh, this is going to diagnose any problem I might ever have. It's like, well, no test is perfect. They all have ups and downs, and understanding what those nuances are and where people should put their priorities is a conversation that you should have.
Well, thank you so much. Really enjoyed our time together. Really appreciate it. So again, please reach out and put your comments below. Thank
My
you.
pleasure. Thanks for having me.